Hello, everyone. Welcome to our presentation of Understanding Medicare. Thank you for taking time to join us. I am going to quickly turn this over to Danny Cohen. Danny Cohen and I actually go back probably 25 plus years now of both being in the financial industry, and he's a representative for John Hancock, an outstanding firm that I've done a lot of business with. And I want to thank Danny for coming on here and helping us with the ins and outs of Medicare coverage. So, Danny, this is yours to take away.
Thank you, Rich. Thank you, everybody, for being here tonight. I know you're all excited to hear about Medicare. I can't believe it's me talking about Medicare here, but I guess I should be excited because I'm the one doing the presentation, right? So I know a lot of you have a lot of questions. I'll probably answer most of them as we go. And we'll take questions at the end. I would say if you have one that's a pretty long one regarding your own personal situation, you may want to set up a conference call with myself and Rich or somebody from the team, and we can discuss your specific situation, but I'm happy to take some questions at the end. So let me minimize my screen. I will tell you all if you're unmuted to mute yourself. If you want to turn your camera off, please do. If not, that's fine too. I don't know if you want everybody staring at you. We're happy to see you. But I'm going to minimize you. Rich, you're looking good, man. And nobody paid me to say that. Okay. Okay, let's get underway here. I know many of you have some questions. And like I said, I'll answer a lot of it. So understanding Medicare, the ins and outs of Medicare. So typically what happens is just before your 65th birthday, you tend to get inundated in the mail with somebody trying to sell you some kind of healthcare plan. It even seems today that they have your cell phone number because as soon as you're turning 65, they're inundating you with texts. It's almost like you got a speeding ticket and every attorney in town knows about it. And now they want to send you a piece of document to let you know they'll represent you to get you off from speeding. So very similar, but typically what happens is you end up going to your mailbox, you're picking up a bunch of literature, and you end up sitting at your dining room or kitchen room table looking like this couple with this confused look on their faces as they're staring at this paperwork. And a big reason for this is there isn't really one place to go learn Medicare. You can see a lot of things online in small bites, but majority of financial advisors in the United States today do not sell healthcare plans and are not as well versed. And it's one of the reasons why they bring somebody like myself on to just really explain the structure of Medicare and some things you want to know if you're enrolling or thinking about enrolling. So I'm not here tonight to sell you a healthcare plan, but I am here to give you a better understanding. So as you're looking at these people, and the fact that there isn't anywhere really to go look to find out how Medicare works, it really does beg the question, is this how understanding Medicare makes you feel? Well, the good part is I'm going to make you feel better tonight because our agenda will include the history of Medicare, Medicare parts and when to enroll, Medicare costs, Medigap plans, also known as supplements. We'll talk about Medicare Advantage plans. And of course, the last section here, working past 65. I'll try to go a little quicker on some things just in the interest of time, but stop and dwell down on some things that I think are a little bit more important and things that you would all want to know. So let's get into the presentation. Let's talk about the history of Medicare. Most people don't know that Medicare was signed into law in July of 1965. It was a groundbreaking event. You can see here on the far right, President Lyndon Johnson signed it into law. But you'll also notice President Truman and his wife Bess here sitting at the signing ceremony. And you might be wondering why. Well, they received Medicare cards 1 and 2. And the reason for that is President Lyndon Johnson realized when we had the ceremony that without President Truman, we really wouldn't have Medicare today, because when President Truman was in office, he was a huge proponent of a national health care plan and Medicare. Even though many of his proposals were defeated while he was in office, it really was not without his push that we wouldn't have Medicare today. And that's why you saw him and his wife at the signing ceremony. But you'll see at the bottom, 19 million beneficiaries initially enrolled. Today, there's over 62 million people on Medicare, and about 40% of those people plus are now on what you know is a Medicare Advantage plan as well. And we'll talk in more detail about that a little bit later. But obviously a groundbreaking event and something that I think a lot of people were really happy about. And again, even today. So As we think about Medicare, it really starts with the parts. I know when I went to learn this, and it took me a pregnancy, 9 months, to really get Medicare under my belt, you'd wake up confused here thinking, okay, there's, 22 parts. There's part A, there's part C, there's part H, there's part Z, and then realize one day it just clicks in your head. There's actually only four parts. There's part A, there's part B, there's part C, and there's part D. So when you think about part A, this is what you know is your overnight stay in the hospital. It's your hospital coverage. You'll see here, think of this as your room and board. It includes blood transfusions and what have you. For most people, part A on the premium, when they reach 65 or when they retire and want to file for Medicare, it's free. And the reason is you paid into your FICA taxes for premium part A. So that's the reason why when you reach 65, if you have the 10 years of work history, it's free for yourself. And then if you have a non-working spouse, they can also qualify. I'll talk a little bit more about that in a few moments. But when you think of your FICA taxes, 6.2% of that goes towards your Social Security. And then the remaining part of the FICA tax, which is the 1.45 for most people, and that's on the entirety of your salary, goes towards Medicare Part A. So just in case you were wondering why is Part A free, that's the reason. It's coming out of your FICA taxes if and when you were working. So very important to know. Now, Part B, the outpatient coverage, this is where everybody has questions. And of course, you have to pay for this part. This is your doctor visits. You'll see here preventative care, outpatient surgeries, physical therapy. If you get cancer, the chemotherapy falls under Part B. And of course, dialysis does as well. But something important to know and read at the bottom here, you'll see Part B covers 100% of some preventative care and 80% of all other outpatient care. So what do I mean by preventative care? Well, it could be something like a mammogram, a colonoscopy, a bone mass measurement, a diabetic screening, all things you can't wait to do, I'm sure. But these things are covered at 100% because they're considered preventative care by Medicare. But let's say you needed an outpatient surgery, something like a cataract surgery or knee replacement, which requires physical therapy, or shoulder surgery, same story with the physical therapy. These things are considered outpatient surgeries. And in that case, Medicare is going to pay 80% of the bill, but you're on the hook for the other 20% of the bill. So if you had something like cancer and you need chemotherapy, you're going to be on the hook for 20% of the bill. So this is where Medicare could get a little scary and concerning. So you'll notice this picture on the bottom right here, this man smiling in a doctor's office. And as many times as I've done this presentation, probably 150 plus, I keep asking myself the same question. Why is this man smiling in a doctor's office? And I realize it's because he hasn't seen the bill. Because if he knew he was going to have to pay 20% of it, he would not be smiling. So just something to know that on the Part B, there's the 20%, and that's something you need to know just as far as original Medicare. But when you think of original Medicare, it's just Part A and Part B. The first two things I just spoke about, Part A being the hospital coverage and the Part B being the outpatient surgery. Part C, which came later, this was signed into law in 1997 by President Clinton. This was a groundbreaking event, also known as a Medicare Advantage plan. So this is where it gets confusing for most people because they never refer to a Medicare Advantage plan as Part C. You don't really hear that term. You just see the Medicare Advantage plan. And these are the ones you see advertised on TV by Joe Namath or, Jimmy Walker from Good Times, Mr. Dynamite. This is more often in the fall because we just hit the fall annual election period here yesterday, and Medicare Advantage plans can be changed in and out in this time frame. So what you want to know about the Medicare Advantage plan is that you can get Part A and Part B and Part D, the drug program, all from one place. You see it in the funnel, or you can buy them a la carte on their own. So I like to think of the Medicare Advantage plan as the travel agency analogy, where you can get the flight, the car, and the hotel all from one place, but you can also buy it a la carte. Part D, which is the voluntary drug program, was signed into law in 2006 by President Bush. This was also groundbreaking. A lot of the expensive medication in Part B now got covered by Part D. You see here, think of this as your pharmacy card. So this is really important, and it obviously was a really big groundbreaking event for people because so many people have been living in poverty for so many years, just having to pay their medication. So just important to know, Medicare tracks this. This is mandatory, and you do need it. A lot of different healthcare plans have it, and we'll talk more as we go. All right, so you're going to be asking me, how do I enroll in Original Medicare? So typically this happens right around your 65th birthday. That's when you're first eligible for Medicare. So you would go on to the Social Security website and you would enroll in Part A and Part B. It takes about 10, 15 minutes online. Or if you worked for one of the railway companies, you do it through the Railroad Retirement Board. Now, I said typically you would do this right around your 65th birthday when you're first eligible, but some people can delay Medicare past 65 if they're working. So I'm going to say this multiple times tonight because this is something you're going to want to remember. But what permits you to delay Medicare past 65? If you work for a company greater than 20 employees, you can delay all parts of Medicare. So let's say you were working till 68 and you work for a big company greater than 20 employees, then you can file at that time when you retire. So if you'll see at the bottom here, if you're already receiving Social Security benefits, you're automatically enrolled at 65. You'll get your Medicare cards 1 and 2, and then they'll deduct the premium out of your Social Security check. So as you're thinking about turning 65, you're going to hear from some of your friends or you've read it somewhere about this initial enrollment period. So this is a 7th-month window period right around your 65th birthday. So how this works is it starts 3 months before your birthday month on the left here in blue. It includes your 65th birthday month, and then it includes 3 months after. So just to give you an easy example at the bottom, let's say your 65th birthday was May 20th. Your initial enrollment period starts February, March, and April. If you sign up for Medicare in any of those 3 months, you would go live on May 1st. Even though your birthday's on May 20th, you would begin on May 1st if you did it before. You will be delayed if you do it during your birthday month, and then you have up until, in this example, 3 months after your birthday, which would be August 31st to get into Medicare. So now that you know you would start on the 1st of the month if you filed before your birthday, people ask, well, what if I delayed it? And as I was saying to you, if you signed up during your birthday month, or thereafter, you'd be delayed up to 3 months after to get it. Now, there is one exception to the rule that if you're born on the 1st of the month, so let's say your birthday was actually May 1st, you would roll back a month as far as your initial enrollment period. So your initial enrollment period would be January, February, and March. You would go live with Medicare on April 1st if you signed up in those 3 previous months, even though your birthday is May 1st. There's about 7% of the population born on the 1st of the month where they roll back a month. And that's just something you'd want to know if your birthday is the 1st of the month. All right, so let's move on from there and let's talk about Medicare cost sharing. So what do you want to know about Medicare cost sharing? Well, I work at John Hancock. We're a big company. We're more than 20 employees, obviously. But every 2 weeks, I have a deduction on my paycheck for my healthcare benefits, which is known as the premium, okay? As I'm sure most of you do. But when I use the medical services, I have co-pays, I have a co-insurance, and obviously I have a deductible as well. These 3 things, co-pays, co-insurance, and deductible, are referred to as cost sharing. So a lot of times people get confused and think that Medicare is free. No, when you actually use the medical services, you probably have some co-pays and co-insurance and deductibles. So just something to know as you're thinking about Medicare. Now let's talk about the out-of-pocket costs and what really actually makes you eligible for Part A and for Medicare in general. So the first thing you need to know, and there's a lot of writing here, so I'm going to read it and then I'm going to add lib to it here. But Part A costs nothing if you've worked and paid into your FICA taxes for at least 40 quarters, which is 10 years. You need 10 years of work history, which would make you eligible not just for Medicare, but it would also make you eligible for Social Security. And I should mention, I said this earlier, that you go on the Social Security website to sign up for Medicare. Keep in mind that Medicare and Social Security work together. So this is really important. But in this case, you'll see here, If you have the 10 years of work history, you're considered paid up for Part A, so it would cost you zero on the premium. But sometimes people ask the question, well, what if I didn't have enough credits? Let's say I had less than 30 credits. How much would I have to pay for Part A? Well, if you had to buy Part A, it's about $500 a month. And if you don't have it and you were supposed to, you could incur a penalty. So sometimes people ask, well, what if I had 9 years and 6 months of work history and I'm missing, let's say, 2 quarters, which is 6 months, one per quarter of credit. I'm missing 2 credits. Can I go back to work part-time to get the 2 extra credits I need in order to be eligible for Medicare? And the answer is yes. People do it all the time. Then you're probably going to want to know, can I qualify for free Part A under spouse's work history? The answer is yes, as long as you've been married a year and your spouse must be eligible for Social Security benefits. So that's important to know. And then you can qualify under a divorced spouse situation as long as you've been married at least 10 years. So I'm going to tell you all, if you hate your spouse, I'm sorry, you're going to have to go live in the basement or out in the shed in the backyard because you got to make it to 10 years. And your spouse, you'll see, must be eligible for Social Security at 62. And you must be single. So if you're divorced and you get remarried, you lose the ability to stay on the benefits of your first spouse. You now go on the benefits of your second spouse. So if your first spouse was the higher earner, you might be thinking twice about getting remarried, right? So I have new dating questions for you if you're divorced. It's no longer, hey, are you a nice person and is your family crazy? You don't care. You want to know what your Social Security and Medicare benefits are, because if they're good, I'll marry you, right? So just some things you want to know about Medicare and a divorce situation. Like I said, once you remarry, you lose the ability to go off the first spouse. You can qualify in a widower situation, as long as you've been married 9 months before your spouse passed away, and then you're single. You can remarry after the age of 60 in a widow situation, in a survivor situation, and stay on the benefits of your first spouse. So if you marry after 60 in the survivor situation, you're still good to stay on the benefits of the first spouse. All right, so now I spoke about the premiums on Part A. Let's talk about the premium on Part B and Part D, because this is really what people want to know. And this is somewhat of a mystery to a lot of people because it's not necessarily quoted everywhere or you don't read it everywhere. So the first thing you want to know is Part B has a monthly premium, base premium of $174.70 here in 24 for new enrollees. And I mentioned that if you're already receiving Social Security, that $174.70 will come right out of your check on a monthly basis. If you're not receiving Social Security, you'll get billed quarterly. The big thing you want to know here is this IRMA for high income earners. So IRMA came out in 2007. Nobody was happy about it, I can tell you. And the reason for that is individuals earning more than, or I should say, more than 103,000 individually, or over 206,000 jointly now have this sliding scale to pay on Part B and Part D, and it's based on your modified adjusted gross income on your tax return. So what does it look like? When you look at the grid, just on the joint tax return, you'll see here 206,000 or less, you're paying that 174.70. So what most people don't realize is there's a 2-year look back on your income here. So Medicare and Social Security work together. They want to see what you were making 2 years ago. So let's just use an example of somebody that's turning 65 here in 2024. They're retiring and filing for Part B. But we're going to assume they were making $500,000 here on the grid. So normally they would be paying $559 for each spouse. So Medicare and Social Security don't know that you retired here at 65. So they have a 2-year look back. They're going to be looking at what you made in 2022 when you were 63. So you're going to be paying $559, which obviously is going to aggravate you. So you're going to have to file an appeal. And this is where Rich or somebody at the group can actually help you as far as filing an appeal. It's ssa.gov is where you'll find the form SSA-44. This is where you can appeal your IRMA. It's also known as a request for reconsideration. So this form is important, and what Social Security and Medicare are looking for is a loss of income in order for you to win this appeal. So something like a retirement, a divorce, or a death between spouses, in those cases, you will win the appeal, right? And you'll go, let's say, down to the base premium or whatever your income is at that time when you retire. But let's say you had an addition of income. Let's say that you had a beachfront property that you sold, an investment property, a business, you did a Roth conversion, or you took a taxable distribution from an IRA. These are all considered taxable consequences. So these are going to be an addition of income, and then thereby you will not be able to win the appeal. Now, you can file the appeal, there's no penalty to do so. But if there's an addition of income, you're typically going to lose the appeal. Now, the good news is it's only for 1 year. So if your income was $500,000 because you sold a business, you're paying $559 a month for each spouse if you're both on Medicare. And then at the end of the year, Medicare and Social Security pull your tax return from the IRS. And then in January, they send you a letter stating whether or not you have an IRMA for the following year. So only for 1 year. You may be wondering, well, what if I was able to delay all parts of Medicare past 65 because you work for a company greater than 20 employees and you retired at 68? Well, it would work the same way with the 2-year look back. They would be looking at what you made when you were 66, and the same rules apply as far as appealing and whether or not you'd win the appeal based on the loss of income. So let's move on from here. Let's talk about Part D, the drug program. So the Part D drug program on average is about $55.50 a month, not too bad, but you're still subject to the IRMA calculation. You'll see here this was started in 2011, where Part D now became a part of this sliding scale on your income and what you would pay on the Part D. And then, of course, Medicare tracks your enrollment. So you must have Part D once you retire, or if you work for under 20 employees, you must have it. You may be wondering, what's the penalty? It's a 1% penalty a month if you don't have Part D and you were supposed to have it. So if you didn't file for 5 years and you were supposed to have it, that's a 60% penalty for life. So those numbers can add up. The good news is a lot of Medicare Advantage plans include it, and I'll talk about that as we go. But a lot of company healthcare plans have it already, so you don't necessarily need to buy it on its own. But here's a look at the Part D tax table. It's the same on the tax brackets for individual and joint, and the 2-year look back's the same. The premiums are the difference on the right. What you want to know here is if you win the appeal on Part B, you win the appeal automatically on Part D. If you lose your appeal on Part B, you automatically lose your appeal on Part D. Okay, let's talk about covering the gaps, because I talked to you earlier about Medicare and the fact that, yeah, it covers a lot of different things, but there's co-pays, co-insurance, and deductibles, which is what I mentioned to you was your cost sharing. So just as an example, if you're in the hospital overnight, you have a deductible of a little over $1,600. So this is where it kind of gets a little scary for people. Or, the part I mentioned to you that if you got cancer on the Part B, you're on the hook for 20% of the bill. And obviously a lot of people don't like that. So there's two ways that you can cover the gaps around Medicare. They're both through the private insurance market. The first is what you know as a Medicare supplement, also referred to as a Medigap policy, where you pay higher premiums but less cost sharing. And this is what we really refer to today as the Cadillac service of healthcare coverage. If you can afford it, the Medigap plan is the way to go. The more affordable way to go is the Medicare Advantage plan, where you have lower premiums and higher cost sharing, which is similar to Medicare, but there is a safety net there, and I'll show you that as we go here. But let's delve into the Medicare supplement, the Medigap plan. What do you want to know about a Medigap policy? So the first thing you need to know is Medicare is still your primary coverage here. You have to have original Medicare Part A and Part B, and then the Medigap company acts as a supplement around Medicare. They pay the additional 20%. They pick up a lot of your copays and deductibles. And as long as the doctor accepts original Medicare, then the Medigap company will pay the bill. So about 93% of the doctors in the United States accept Medicare. and thereby the Medigap company, the insurance company, will pay the bill. A lot of people like Medigap policies because you can travel with them. So for any of you that are snowbirds on the call, you're going down to Florida or you're going out west to Arizona, the Medigap policy travels with you. You do not need to get a separate plan. So as you're looking at the plans here, and I apologize if this is a little small, it's meant to be on a conference room board here, but there are 10 Medigap policies today in the United States. The plans were standardized in 1990. What that means is the benefits do not change. So if you call Aetna, Humana, United Healthcare, Blue Cross, Blue Shield, and they offer a Medigap policy, they're all going to have the same benefits. The difference is the prices. So the prices change in a Medigap policy, the benefits do not. So if you're buying a Plan G from any of those companies, you're going to see the same benefits here. So the two most popular plans in the United States today are Plan G for George and Plan N for Nancy. And the reason why they're popular, you can see right up top here, the Medicare Part A co-insurance and hospital costs. They give you an additional 365 days and they pay for that $1,600 plus deductible in the Medigap policy. The only thing you're responsible for is the Part B deductible, which is $230 for the year. So you pay a one-time $230 fee, and that's for each spouse. It's not one per couple if you both are on Medigap policies. In the case of Plan N for Nancy, the difference between this and Plan G is that you notice here at the bottom, Medicare Part B excess charges not included. What that means is the doctor can upcharge you on the bill up to 15% if they don't accept Medicare's assigned rates, and thereby Plan N is a little bit cheaper than Plan G. So that's important to know. Okay, so how do they price them? Well, the insurance companies set their own rates. So if you buy it through an insurance broker or directly from the Medigap company itself, it's going to be the same price. There's a built-in commission there for the insurance agents. But they're priced on age, zip code, gender, tobacco use, and of course, there's eligibility for household discounts. But each spouse must have their own Medigap policy if they're eligible. The plans are going to be cheaper in places like Iowa and Oklahoma, obviously because there's less retirees versus what you might have in Florida. So that's why it's a little bit more expensive there. So when you put it all together, when you want to price it, here's what it looks like. Remember, when you have a Medigap policy, you first need to get original Medicare Part A and B, then you get the Medigap policy, and because Medicare and Medigap do not include a Part D standalone drug program, you have to buy one. So here's the cost. The Part A, the premium I told you is zero for most people with the work history of 10 years. Part B premium on the base premium is $174.70 for this year. The Part D average drug program $55.50. And then a Plan G Medigap policy is anywhere from about $100 to $160 here in the Mid-Atlantic. I think if you just add $20 here and just assume $350 a month for the entire coverage, that's pretty good coverage for each spouse. So that's about $700 for the both of you. But like I said, $350 if you want to use some math on figuring out what it would cost. It might be cheaper for you if you're a spouse on your spouse's insurance at their work. So sometimes you have one spouse that's on the insurance of the other spouse. You could be paying $8,000, $9,000. You're 65. It might pay for you to stop that plan and go on Medicare, get a Medigap policy and a Part D drug program, and you might save yourself anywhere from $3,000 to $5,000 kind of thing. So important to know, just something to be thinking about. So some important benefits to Medigap policies, things that people like about. So number one is the open enrollment one-time window that you get. So let's say you're retired at 65 and you file for Part B. What happens is you get an immediate 6-month window to get into the Medigap plan without any health questions. So if you were sick at 64, you had cancer, you're diabetic, at 65, the insurance company cannot ask you any health questions. So you're basically going to be approved. So that's important to know. And then you may ask, well, what if I was able to delay all parts of Medicare because I work for a company greater than 20 employees and now I'm retiring at 68. Well, when you retire at 68, you're then again going to file for Medicare Part B, and then you'll get that 6-month window again with no health questions. So these are two important windows to know. You may ask, well, what if I'm an accountant and I have 2 employees, so I'm less than 20 people working at my company? Do I get a guaranteed issue period? And the answer is yes, you do. You must file at 65 for Medicare, but let's say you don't retire until 68. As soon as you lose credible coverage when you retire, you will get a 63-day window to get into a Medigap policy with no health questions. So those are the 3 windows you want to know about. If you don't fall into these 3 windows for whatever the reason, you're going to need to go through medical underwriting, which is a 2 to 5 year medical history. All right, so a mistake that people make is they confuse the Medigap open enrollment period with the fall annual election period. So what's the difference? The Medigap open enrollment period is when this Part B goes effective date. You get that 6-month window to get into a Medigap policy with no health questions, which has nothing to do with the fall annual election period, which is what we're in right now. That was yesterday to December 7th. And what that is you can see in the second line, is when you can change your Part D drug program or your Medicare Advantage plan. If you're in one, you may want to shop it because you found something with better benefits and a cheaper price, or you didn't file for one. I just talked to a lady today who's 66. She just retired. She missed the window when she retired for the Medicare Advantage plan, and now she's shopping one in this window. So important to know. All right, so let's finish up on the Medigap policy. What are some things you want to remind yourself about in summary? First question you want to ask the doctor before you even go is, do you accept original Medicare? Remember I said if the doctor accepts Medicare, the Medigap company will pay after Medicare because that Medicare is still 80% of the coverage. I mentioned to you the plans are standardized. That means the benefits don't change. Only the prices do. You're guaranteed renewable. So if you're 65, you went into a Medigap policy, you were healthy, and then you got sick at 67. The good news is that they have to keep you in the plan. They cannot throw you out. So you're guaranteed renewable. And then I mentioned that if you have a Medigap policy, you have to add a standalone drug program because it's not included. So I'm not going to go over the Part D. All I'm going to tell you, just in the interest of time, if you want to shop a Part D drug program, the website is right here at the bottom, mymedicare.gov. The good news is that if you buy a Medicare Advantage plan or a Medigap policy from an insurance agent, they're more than likely going to help you find a Part D drug program if you need it. They don't really make a lot of money from selling Part D drug programs, but they usually include it to be nice. So just something you want to know. Let's get into Medicare Advantage plans because I know a lot of you want to know a lot more about this, given the fact as soon as you shut this webinar off, you're going to turn on your TV and you're going to be, pounded with Medicare Advantage plan commercials, especially probably during the baseball game tonight. But what's going on here with a Medicare Advantage plan? So what you're doing here is you're choosing to get your healthcare benefits administered to you through a private insurance company like Humana, Aetna, or Blue Cross Blue Shield versus the government. So what are insurance companies in business to do? To make money. So what they're going to do is they're going to limit you to a local smaller network of doctors. The good news, as I mentioned earlier about Medicare Advantage plans, about 90% of them include a Part D drug coverage program. So you don't need to get one on its own. And then you'll see at the bottom, you're still going to need original Medicare. You must be in Part A and Part B in order to be even eligible for a Medicare Advantage plan. But they work similarly to what you may have right now at your company. Here at John Hancock, we have an HMO and a PPO plan. So in the case of the HMO, you do need a primary care physician because you need to get referrals to go see specialists. People don't love that, but you'll see here, usually no out-of-network coverage except for emergencies. And then a lot of people don't like necessarily that you need a prior authorization for medication. So sometimes people want to go with the PPO. As long as the doctor agrees to bill the plan, you're good. A big thing that sells Medicare Advantage plans in general, whether it's PPO or HMO, is they include routine dental, vision, and hearing. I didn't talk about this earlier, but Medicare and Medigap do not include routine dental, vision, and hearing. I know that sounds crazy. It sounds like somebody in 1965 didn't think you needed your teeth, your ears, or your sight, but the truth is you do. We know you do. There are proposals in Congress to change this. Nothing's been set in stone or agreed upon, but obviously a big thing when you're talking about routine dental, vision, and hearing. So, what does it look like when you try to put some numbers behind what it would cost? So, the first thing is the primary care visit to the doctor would be $20, which is probably similar to what you're paying now. A specialist is 50 per visit. You'll see here the hospital is 200 a night for 5 nights. You can't even stay in a hotel Marriott anymore for 200 a night. That's actually a good deal, believe it or not. Not that you want to stay at the hospital, but you get my point. The ambulance is 300. I always tell people, look, unless you're dying, take an Uber. It's cheaper. But you'll see here chemotherapy, oxygen, and dialysis. You're still on the hook for 20% of the bill up until you get to your out-of-pocket maximum. So this is the biggest selling point to Medicare Advantage plans. It's the out-of-pocket maximum. You'll see it at the bottom here. Medicare set it at $88.50 for this year, 2024. And what that means is you will pay 20% of the bill up until you get to the $88.50. Once you get to the $88.50, then the insurance company picks up the rest. So if you had the major illness like cancer and you need the chemotherapy or dialysis, you have kidney failure and you need dialysis. In essence, it's catastrophic insurance where everything above this 88.50 is covered by the insurance company. Now, this number can be lower. I know my parents, for instance, who live in Florida, they're on a Humana Medicare Advantage plan, and they have about a $3,500 deductible. So it just depends on the plan that you have as far as what the deductible will be, but it can't be more than $88.50 for this year. So very important to realize, similar to Medicare with the 20% out of pocket, but there's an out-of-pocket maximum, which is your biggest safety net with Medicare Advantage plans. All right, so because you heard me mention the 20% out of pocket, people ask the question, are Medicare Advantage plans bad? No, you just need to realize that if you need an MRI or a CT scan, or you have dialysis, or I mentioned the cancer treatment, you're going to probably be on the hook for 20% of the bill, similar to Medicare, but you have that out-of-pocket maximum. So tips for Medicare Advantage plans. So number one is build a rainy day fund for unexpected costs. So a lot of people have what's known as health savings accounts, HSA accounts. The only thing you need to know here is that if you're contributing to an HSA account and you decide to file for Medicare at 65, you must stop contributing to that HSA account the day before your 65th birthday. And the reason for this is that Medicare and Social Security have a 6-month look back, a retro look back. So the IRS will hit you with an excise tax penalty of 6% if you're still contributing. And also, if, let's say, you're working past 65, you're allowed to because you work for greater than 20 employees and you're still contributing to the HSA, you must stop contributing to the HSA 6 months before you retire. So if you're 68, you must stop 6 months prior to your 68th birthday when you file or when you retire and file for Medicare Part B. If you decide, hey, I'm going to retire in July, you may need to stop contributing to that HSA November 1st when you have your enrollment period at your company. You probably want to talk to your HR about that, but that's just something you should know. It's an IRS rule around that. All right, number two, how and when you enroll in a Medicare Advantage plan matters. You heard me talk a little bit about that earlier. And then, we say consider large carriers because the large national carriers usually have the best benefits. And then the fourth thing, which is important, is don't forget to reevaluate your plan each fall. The reason is because the benefits and the prices change. So in September of every year, you get an annual notice of change letter, which will show you whether or not your medication is still in the drug formulary and that your doctor is still in the network. There's nothing worse than going to a pharmacy in January on a Saturday and standing behind 8 people with one cashier for a half an hour and then getting up there and hearing, hey, I have a bill for $1,000 and all of a sudden you're freaking out at the cash because you don't understand why. The reason is because you realize that your medication is no longer in the drug formulary. So you can't switch out of a Medicare Advantage plan in the first quarter, but this is important to know. And that's why in September, if you're on a Medicare Advantage plan, you want to make sure that your doctor and your medication is still covered. All right. So mistake that people make is they confuse a Medicare Advantage plan with a Medigap policy. What's the difference? The Medicare Advantage plan, remember, the benefits and the prices change every year, which is the reason why you see it so heavily advertised on TV, because the insurance companies make a fortune with these plans. The Medigap policies, I mentioned to you, the benefits do not change, only the prices do. And that's why you don't see those advertised as much as Medicare plans. All right, I think somebody has me on open line. Maybe if you can mute, that would be great. And then maybe unmute when we come back for questions. So let's move on from here. Let's talk about the last section, working past 65. I know a number of you are probably thinking, hey, this gentleman's shooting water out of a fire hose here, and it's coming fast and furious. If you pick up one or two things tonight, that's great. It's not easy to learn Medicare in one shot. Listening to it multiple times is a great way to learn it. So don't feel bad if I'm talking fast and you're picking up a few things. As long as you're picking up a few things, we're good. These are client-approved slides, so I believe that Rich and the group will send this out after the fact. There are notes, but let's talk about working past 65. So if I was putting you to sleep or you slipped into a food coma because you already ate dinner, this is probably the most important slide in the presentation. So many of you want to know, what makes me eligible to delay Medicare past 65? Here it is. If you work for a large employer, and you heard me say this a few times, if you work for a company greater than 20 employees, you can delay all parts of Medicare without a penalty. In this case, the group coverage is primary. They pay 80% of the bill. And Medicare would be secondary. If you filed for Medicare Part A, you would get extra in-hospital coverage. As long as you weren't contributing to an HSA plan, you can turn your Part A on at 65. It's free for the premium, so no penalty to do so. In the case of a small employer, less than 20 employees, Medicare is primary, meaning Medicare pays 80% of the bill. Your group coverage pays the other 20%. And then, of course, in this case, you must be enrolled in both Parts A and B, and you should have D. And you may be asking, okay, what's the penalty for Part B if I'm not in Part B? The penalty is 10% a year. So if you were supposed to be in Medicare and you did not sign up for 2 years, when you go sign up for Part B, you will get a 20% penalty because it's 10% a year. Some people ask, well, what at 65, what do I need to do if I don't need to file for Medicare or I didn't? Remember, Medicare is not sending you a bill to your house. They don't know what your story is as far as Medicare. The only time you get penalized or they start asking questions is when you actually file past that 65th birthday. That's when you would receive the penalty on Part B and on Part A if you were supposed to have it. You'll see here that if you are on COBRA or TRICARE for Life, which is for military or retiree coverage, you still must file at 65. These things are not considered credible coverage for Medicare, so you must file at 65 if you have one of these three things. All right, now, quick review. So first and foremost, I mentioned on the left here, you do need original Medicare Part A and Part B. But if you can afford it, you go in the middle with the Medigap policy, and then you need a standalone Part D drug program. Yes, higher premiums, but little out-of-pocket costs, and of course, no doctor networks. The more affordable way to do it is you get original Medicare. You go down to the bottom and you go with a Medicare Advantage plan where you have lower premiums, more cost sharing, similar to Medicare itself, and then limiting yourself on the doctors. So you'll see the other way you can go, the third way, which I don't recommend, is you get original Medicare. And because you're healthy, you think, hey, I don't need anything. I'm going to go with no supplement. Well, the problem is, on the Part B, there's no cap on the spending on that 20%. So what happens is people turn 65, they're healthy, and then at 67, they get sick, and then it's difficult and expensive for them to get medical coverage after the fact. So this is the review. The last slide here just some resources for you. Number one is the Centers for Medicare and Medicaid. I didn't talk about Medicaid tonight. Medicaid is for lower income individuals, and this is where Medicare and Medicaid will work together to pay your premiums or your cost sharing. That's where you go to Medicare.gov. You'll see the Social Security Administration. If you're going to sign up for Medicare, I mentioned you do it through the Social Security website because they work together. You'll see it there, SSA.gov. I tell people on these calls every time I do it, do not spell SSA.gov backwards, because if you do, you're going to end up on a website that's going to give you nightmares for the rest of the night. Now, I haven't been on it, but I've heard stories. So SSA.gov, make sure you spell it correctly. You'll see under 65 is Obamacare. This is where you go to healthcare.gov. So let's say you're 63, you retired, and now you have no healthcare plan. In order to bridge the gap, let's say from 63 to 65, you go on the healthcare.gov website and you can get yourself a healthcare plan. You'll see here some national healthcare broker recommendation, or who we refer out to. You'll see boomer benefits. So I don't know necessarily if Rich and the group has somebody they refer locally to who's a Medicare broker, but I do recommend a Medicare broker regardless of who it is, because they have access to many different national healthcare plans versus you just going to, let's say, United Healthcare and getting one plan. This way you have choices. We use a company called Boomer Benefits. We don't get paid for referrals. Boomer Benefits we don't pay them. They don't pay us. They are the ones we paid to write this presentation. They're a national healthcare broker out of Dallas, Texas. They have a lot of great videos on YouTube. If you're trying to learn Medicare in small bites, meaning you listened to me tonight and it was a little confusing, you want to go back and learn more about what a Medicare Advantage plan is, there's a nice lady that has about 100 videos on YouTube. You just go in and put in Boomer Benefits, Medicare, and all these videos will pop up. And you'll see a video there, maybe 5 to 12 minutes, on what is a Medicare Advantage plan, all these different subjects. So just some resources for you. That's now where we come to the end. I will say thank you